Good morning everyone, I'm Christine. I'm going to discuss about the association between 4 contemporary techniques and patient-reported quality of life among men with localized prostate cancer. So, patients with prostate cancer often have extended life expectancy. Therefore, the quality of life effects of different treatment options is a central consideration for the decision-making process. The contemporary technologies we mention here are radical prostatectomy, EBRT, brachytherapy, or those who pursue active surveillance. These technologies were developed with a primary purpose to reduce treatment-related morbidity. The purpose of this study was to analyze the QOL changes from the baseline through the 2 years after treatment for men who receive contemporary techniques. So this is a population-based prospective cohort in collaboration with the NCCCR. 1,141 men with newly diagnosed prostate cancer were enrolled from January 2011 until June 2013, and the final follow-up date for current analysis was September 9, 2015. So this table shows the propensity-weighted PCSI score for sexual, urinary, and bowel symptoms over time across different treatment groups among men with newly diagnosed prostate cancer. The PCSI has 4 domains. Each domain is scored from 0 to 100, with a higher score indicating more or worse dysfunction. Next, we're going to move to the discussion part. In terms of treatment groups, we're going to look at the active surveillance group first. We can see that the mean QOL score for this group remained at the baseline level until the 12 months. And after that, it noticeably increased, especially in the urinary incontinence and the sexual dysfunction domain. However, we can see that the mean QOL at 24 months were not clinically meaningful when compared to the other treatment type. Next, for the active treatment group, we can see the mean QOL spikes after 3 months after treatment. However, these treatment-related symptoms have shown gradually improvement over time. So, in terms of PCSI domain, for normal sexual function baseline, we can see that men who chose the active surveillance has the highest proportion with preserved normal sexual function at 24 months. On the other hand, 57.1% were estimated to have poor function at 24 months after prostatectomy. So the strength of this study compared the 4 treatment options for the most relevant contemporary patients. This study design also involved a large group of subjects, and the population-based design facilitated a socio-demographically diverse cohort. And all the patients reported pre-treatment QOL without recall, which allows the accurate calculations of the treatment effect. On the other hand, look at the limitation. Because it is an observational study, there may be imbalances in baseline patients' characteristics, and there was missing data, especially with longer follow-up time. Only through 2 years of follow-up, the QOL may continue to change for more than 2 years after treatment, and this trial, the follow-up is ongoing. And the other one is no dose toxicity evaluation in the study. As in conclusion, this cohort of men with localized prostate cancer, each treatment strategy was associated with distinct pattern of adverse effect over 2 years. Active surveillance may be associated with preserved QOL at least in the first 2 years after the diagnosis, and the QOL aspect can be improved after the treatment also. So, this is my reference, and thank you very much.